Hello everybody, my name is Isaac,
I'm Natasha.
I'm Monica.
I'm Miranda.
I'm Tashi.
and we are here to talk to you about our innovation for cancer patients. So, our innovation is Cancer Connect. In our presentation, we'll be covering the future of cancer, what services our innovation will bring to the patients, how we plan to budget this innovation and the staffing, and how it will be impactful to all of the cancer patients, and lastly, a demonstration of our innovation's practical usage. So, today in the United States, there's estimated to be more than 16 million cancer survivors. The National Cancer Institute estimates that 26.1 million people in the United States will be living with cancer by the year 2040. So, while the number of cancer survivors is expected to continue to grow, technology needs to be advanced as well to keep up with the demand of care. Cancer is one of the leading killers for the United States population, and living with cancer can be extremely hard and stressful on the mind and the body. Cancer patients need all of the information they can get and all of the support they can receive in order to live a normal life. Our application, Cancer Connect, can help. To give a brief overview, our innovation is a complex application that has the potential to help millions of cancer patients in the United States and possibly expand globally. Our application offers a personal way for patients and care providers to seamlessly connect through technology. So now that has been said, we'll go ahead and introduce Natasha, and she'll go ahead and tell you about our application services.
Thank you. I'm Natasha, and I'm here to talk about our app services for Cancer Connect. Our main goal for Cancer Connect is to create a welcoming and supportive community for cancer patients, since we all know it can be such a difficult time period. Cancer Connect will encompass optimal health and mental well-being for all cancer patients, no matter their stage, age, or circumstances. We will have 5 main features on Cancer Connect. The first main feature is our Breaking Health News page. Our team of writers and editors will manage this page of articles covering news on cost, access, and quality. They will also be reporting on any major health news. This can be local to the patient or even international. Our second main feature of our app is going to be our search engine. This is for patients to be able to search any terms, types of cancers, treatments, and even helpful videos regarding their diagnosis and situations. This would act as an informational guide for the patient. For example, they can search up any helpful tips and maybe find some helpful mental health exercises to better manage their stress during this time. Our third feature of Cancer Connect is the personal calendar. This would be a place for patients to record their appointment dates and schedule reminders. It could either be a month in advance, to a week in advance, to a few days, or a day prior. They could use this feature and set their reminders so that they can keep up with their busy schedules. Patients can also use this feature as a journal by being able to log and track meals, emotions, and daily activities. So they can log what they ate that day, how they're feeling, maybe their symptoms that they're having, so that they can bring it up to their healthcare provider, as well as keeping up with physical activities, which are very, very important during this time. This would help patients with keeping up a routine and encourage their mental well-being. Our fourth feature of our app is the Ask a Health Professional page. So this is where patients can go to a live chat or ask any questions and raise concerns to a physician in their area or any area. Physicians would be included on this feature, as well as physician's assistants, registered nurses, nurse practitioners, and even mental health counselors. They can also find physicians in any area that they wish to go see. This is very important because we know it's very important for the patients to get second opinions and even multiple opinions, especially if they don't have access to a lot of healthcare providers in their area. And last but not least, patients will have the choice of a private or public profile. They can also stay anonymous and get the feel of the app first before creating their profile. We wish to create a welcoming, loving, supportive community and facilitate followers to friends. Their profiles would include their profile picture, their name or nickname, and a biography. They can start group conversations or privately message each other. Posts can be a photo, a link to a website, or a written status. Comments are also optional, where the patient can decide whether to activate or deactivate replies for their posts. GIFs and memes are welcome to create a lighthearted community, and motivational, inspirational videos can be posted, as well as their personal pictures and stories. Patients can enable notifications based on their preferences, and this will be set up during creating their profile. Thanks for your time, and next, Monica will be breaking down our financing for Cancer Connect.
Speaking of which, our app features are the main cost driver of our app. And the most influential factors include the vendor type and location, in which ours will be a hybrid of a social networking and user authentication app. Also, our app will be US based. These will include interacting with data, such as favoriting an article, syncing data across devices, push notifications, and perhaps collaborative features such as inviting family members and other patients. The complexity and the number of the app features in which are influenced by the app features that Natasha mentioned, and the back-end infrastructure and connected application program interface, which is just a set of routines, protocols, and tools for building the software applications. The complexity of user interface / experience design, which are more the analytical and technical field and the graphic design aspects of the app, as well as inclusion of additional branded visual elements, development approach, which, like I said, our app will be a hybrid app, the number of platforms to be developed, in which we chose our app to be available through iOS, Android, and through web. As for staffing, we regarded our budgeting on studies, where it says that 35% of the total budget is most likely spent over the next 2 years, and that after an app launches, like $5,000 to $10,000 are spent on further support and app development annually, as well as 50% of the app cost will be spent on maintenance during the first year and 25% on the second, and roughly about 15% to 25% on each of the subsequent years. And the formula that we use to calculate our app development cost is the total development time times hourly rate equals the cost of our app. And as we were hoping to receive $1 million from all of you, we allocated our the money, and we divided it by the stages and the staffing of our app. So for pre-development stage, which includes the research and development of our app, will be supervised by our CEO, in which we will allocate $100,000 for the user interface / experience design, which will be led by our application designer. We'll allocate $200,000 on that. The app development, which will be led by the software architect, we will allocate $200,000 on that as well. For the app testing and deployment, which will be led by the operations manager, we'll be allocating $150,000 for that. App testing, ongoing support and maintenance will be in charge by the project manager. Will also allocate $150,000 on that. And for server and system administration, which will be supervised by the business analyst, we'll allocate $100,000. And for the marketing and sales, which will be run by the marketing team, we'll allocate the rest of the money, which is the $100,000 left. And the other deliverables that can be Supervised by the CEO or the product owner will be market and competitor analysis. Another deliverable by the software architect will be estimating how long it will take to create the app, such as making sure like the app and like the individuals that are working in our app works at the speed and ability that makes sense to our budget, including project and architecture planning. And for the project manager, that person will make sure to deliver our app on time and on budget, including product backlog. And lastly, the marketing team will be in charge of advertising, selling, and delivering products to consumers, which are the cancer patients, as well as to other healthcare facilities such as hospitals and like elderly centers. And lastly, for our operations, which will be solely dedicated on the discovery stage and pre-development or discovery or research aspect of our app, will be will be run by the CEO, and to make sure that the staff of our app development will have background of cancer and like just in the healthcare system. And this will benefit us by time and cost savings, requirements validation, goal-based design solutions, risk coverage, synchronization of the product owner with the team, and app project task prioritization. And next, I'll be calling out Miranda to talk about the values of our app.
So I'll be talking about the value or the impact outcomes of our innovation. So our impact in terms of quantitative outcomes would be to measure the amount of individuals that use our application on a daily basis. So to make Cancer Connect as impactful as possible, we want to make it easy and accessible to everybody in all age ranges. So young adolescents and young adults tend to be on their phone more often, and they know how to work the device, so they could easily access and use our application without any problem. As for older adults and elderly, they would need their caretaker to help them navigate around the application, from showing them how every aspect, as well as showing them how to get around, how to get to each and every service. So the application will be made very simple and easy, so that there wouldn't be any confusion when operating the system. To make our innovation as inclusive as possible, we will make it accessible to all devices. Some apps tend to only be available on certain devices. For Cancer Connect, we want to make it available to iPhones, Androids, their respective tablets, as well as have a website that anyone can access through a computer or laptop. And then impact in terms of qualitative outcomes would be to provide accurate and up-to-date information and resources for our users. We want to create positive change when it comes to cancer, meaning more individuals will be accessing cancer screening resources, so that they could get screened early and they could get treatment early, rather than getting diagnosed with cancer at a later stage and a more severe stage of cancer. Next will be Tashi with practical use.
Hello, my name is Tashi again. So I'll be talking about practical use. So through our app, cancer patients no need to worry about forgetting upcoming appointments, like my friend Natasha already mentioned that. Any health-related messages will be delivered directly to Cancer Connect app, and it has ability to keep up with the news on related health issues. It will help to keep focus on lifestyle behaviors like diet, stress, exercise, etc., and also notifies patients about their immunization, provides the summary of health stats. Patients can link any questions to ask at your next appointment with a current symptom and medications, and also assist patient to find a doctor and notifies on issues that patients are following. So this kind of app adds value to the patients and provide as many information needed to know about their health status, and provides easy access to healthcare providers. Therefore, Cancer Connect app should be supported by healthcare providers, as this could be regarded as one-stop shop, because it will have most of the feature and practical use case that most patient and healthcare provider would need. With enough support, even more features could be added that could be crucial to the patients. There still are remote areas where accessing healthcare providers is very difficult, and this app could act as the front door to those kind of patients. With the use of Cancer Connect app, the health service process will become smooth and more convenient, And thank you so much for listening our presentation. Thank you.